nagbabalik po ang Doctors on TV. Mga kasambahay, National Epilepsy Awareness Week ngayong linggo. Kaya ang topic natin, epilepsy or seizures. Panoorin muna natin ang video na ito.
Ang epilepsy ay isang uri ng neurological disorder na kabilang sa 6 diseases of concern sa ilalim ng National Health Policy ng Department of Health simula pa noong taong 2002. Tinatayang 1% ng populasyon ng mundo ang apektado ng epilepsy at 80% o 80% nito ay naitala sa mga developing countries. Sa Pilipinas, tinatayang nasa humigit kumulang na 900,000 katao o 230 per 100,000 population ang apektado nito. Dahil dito, idineklara ng Department of Health ang unang linggo ng Setyembre bilang National Epilepsy Awareness Week. Layunin nito na mas mapataas pa ang antas ng kaalaman ng publiko kaugnay ng epilepsy. Batay kasi sa mga pag-aaral, ang sakit na ito ay maaaring makapagdulot ng adverse psychological and emotional effects at disability. Kaya dapat nating maunawaan kung ano nga ba ang epilepsy sa tulong ng mga expert, Doctors on TV.
At yan po mga kasambahay ang topic natin for this morning, epilepsy or seizures. To help us, we've invited a very special pediatric neurologist from Laguna.
Si Dr. Jeannie Ahoro, isang pediatric neurology demyelinating disease specialist. National First Vice President din siya ng Philippine League Against Epilepsy. Please take note of the website, www.plae.org.ph. Board of Trustees din siya at member ng Child Neurology Society, Philippine Pediatric Department, Chair din ng Calamba Doctors Hospital. Dr. Jeannie Ahoro, good morning.
Good morning, Dr.
Good morning. Good morning.
Good morning, and thank you for joining us on this Sunday morning. So, Dr. National Epilepsy Awareness Week. Clarify muna natin, ano bang epilepsy at bakit nagkakaroon ng ganito?
Well, actually, ang epilepsy is a condition, no, kung saan nagkakaroon tayo ng mga pag-aatake. We use the term pag-aatake kasi if we limit it with just the term convulsion, na kadalasang ginagamit, no, ang nasa isip lang nila kasi yung nangingisay, bumubula ang bibig, no? But there are other, manifestations of seizures, no? So, ang dahilan nito, nagkakaroon ng excessive or abnormal daloy ng kuryente sa utak ng tao, no? Kung pwede natin siyang ihalin tulad sa isang wiring na nag-short circuit, and then yung pag-short circuit na yon is the clinical manifestation.
Short circuit. Kaya pala, Doktor, ganun ba talaga kagrabe yung movement ng
like
katawan?
I mentioned earlier, marami kasing types ng seizures, no? Hindi lang yung nakikita natin na nangingisay, tumitirik ang mata. It can be just abnormal sensation. The patient may be aware or yung level of conscious niya, he can still be very alert, he's aware of his surroundings, but he's having seizures already. Ito yung mga partial type of seizures na sinasabi natin. Pwedeng kalahating parte lang ng katawan, pwedeng focal twitching lang ng face, no? Pwedeng, like I said, pwedeng nagkakaroon siya ng abnormal na sensation kung saan nakakaamoy siya ng masangsang na amoy or sobrang bangong amoy, pero hindi na amoy ng mga tao sa paligid niya. No?
Di ba meron din, Doc, na yung parang natutulala lang?
Merong natutulala lang, no? Parang nakatingin lang sa kawalan. No? And this can last from a few seconds to several minutes or even hours.
Yan ba, Doc, yung tinatawag nila na non-convulsing?
Non-convulsive.
Kasama ba sa epilepsy yun?
Yung mga non-convulsive seizures, yun nga, hindi sila yung talagang nangingisay na nakikita natin.
Kasi usually pag narinig natin seizures, ang narisip natin yung
kagaya na sa video, yung nakaganyan talaga.
Actually kasi is, syempre, medyo may kakulangan pa sa kaalaman. No? Actually, even in our field, there are still some people who are not really
well-informed.
So it can be as mild as parang blank stares lang, or abnormal sensation, convulsion, pala seizure na pala yan.
Yeah, seizures, yes.
But not necessarily
Yung the convulsive.
yung typical kasi yung nakatirik yung mata, nangangasol yung
bumubula.
Pero doktora, curiosity. Ano ba ang mas delikado? Yung may nakikita na manifestation o wala? Kasi may mga nagko-convulsion din na apart from yung nakatulala na siyang ganun, yung parang feeling niya wala siyang maalala lang eh. For a long time. That's why may mga cases din na all their lives, kailangan meron silang shadow. Dapat may kasama sila parati kasi otherwise, naliligo sila, bigla na lang sila nakakatulog. Yun pala, nagigising sila, nasa kama na, kinarga na lang sila. Doktora, anong difference ng mga ito?
Okay. With regards to dun alin ng delikado, okay, siguro mas at risk yung patients who have alterations in their consciousness during an attack na ma-aksidente o madisgrasya. Okay? Basically, of course, syempre, pag altered ang consciousness mo, hindi ka aware sa nangyayari sa paligid mo, it can put you in danger. Like, for example, if somebody is going up the stairs and then suddenly has a seizures, loses his consciousness or his awareness, then he can fall off the stairs, no? Ang isa pang pagkakaiba, kasi syempre, yun nga, gaya ng sinabi natin kanina, may iba-iba kasing forms yan. At seizures in itself is not as delikado as what a lot of people perceive. Kasi na-aware naman tayo na pag may nagkukumbulsyon, imbis na patakbo para tumulong sa pasyente, nagtatakbuhan sila lahat palayo. Dahil natatakot sila. Diba?
Baka mangagat.
Well, that's the reason why we are trying to create awareness about what epilepsy is all about, no? Para hindi ito katakutan, we're trying to demystify it, no? Andyan pa yung kasi na sinasabi nila ng isang pasyenteng may epilepsy, sinasapian ng demonyo, no? Na nakakahawa ito, no? These are all myths. These are all myths.
Kung so na-mention niyo yung epilepsy is caused by problems sa electrical currents sa brain.
Yeah.
Bakit ba nagkakaroon ng problems na ganito? At sino yung mga nagkakaroon ng ganito?
Kaya tayo nagkakaroon ng ganito, no? Who are the people who are predisposed to have epilepsy? Well, in about 60 to 70% of patients with epilepsy, they can be like us, normal. You won't even, you meet them up, nakikita mo sila, nakakahalubilo mo sila, and you won't even be aware that they have epilepsy. Okay? Pero may mga taong predisposed to have it if they have problema sa utak nila. For example, in adult patients who have had stroke, there's a certain percentage of patients who have had stroke, pwede sila magkaroon ng epilepsy. Those na nagkaroon ng infection sa utak, kagaya ng meningitis, encephalitis, no? Mga pasyenteng nagkaroon ng tumor sa loob ng utak, mga vascular malformations, no? Yan, these are some of the examples, no? Mga congenital abnormalities.
Kasi ang field niyo pediatrics, so yung mga batang nakikita niyo.
Yung mga pinanganak na nagkaroon ng problema sa pag-anak, kinapos ng oxygen, yung asphyxia na. Perinatal asphyxia. Doctor, you're very much aware. No? Those are patients who are predisposed. And of course, genetic also plays a role. A certain percentage of these patients have genetic predisposition
so, minsan
to develop.
namamana din.
Kung yung mom or dad mo nagkaroon ng epilepsy or mga seizures, posible na mamana din, mapapass on ng mga bata.
They say about if one of the parent has a history of seizures, that 25% of each child will have a 25% chance of developing seizure.
Doktora, is there
pareho, di doubles.
50.
That's each child. Hindi yung apat ang anak, kalahati. No. Each child will have a predisposition, a risk to do develop.
Doktora, pag nalaman natin na predisposed ka na, may paraan ba na maiwasan natin ito?
Well, actually, we really cannot say naman kasi when it will occur. So nobody can predict. Of course, except for those who have aura prior to their attack. Yan, usually sila, pwede na silang, halimbawa, nakakaramdam na sila na darating, they usually try to go to a place where they can be safe. No?
They can
So,
be safe,
pwede na
yes.
silang umupo, pwede na silang humiga, nakakaramdam na sila nung aura na tinatawag.
Usually ba at what age nang manifest yung seizures sa mga bata?
Any age,
Kahit
like I
na
said, even a neonate
newborn,
can have
pwede.
seizures, yes. Oo.
Pwede na mag-seizure.
Yes. So, any age group, any of us here can have epilepsy at any point in our lives.
Pero pwede din siyang mag-manifest late din.
Oh yes, yes. Like I said,
Time.
yung mga secondary type of, ito yung mga symptomatic type of seizures, those who have had stroke, yung mga traumatic brain injuries. Yeah.